I'm Jonah Comstock, Editor-in-Chief of Pharma Forum, and I'm here at ASCO 2024 in Chicago. It's Sunday, and I'm joined by Thanos Zomas, the Global Medical Lead for Lymphoma at Takeda.
Hi, Jonah.
Thanks for joining me.
You're welcome.
So, talk to me a little bit about the data you guys have today. It's the Adcetris trial with Pfizer, right?
Right. So the study is called HC21. It's not actually a corporate study. It's an independent research study. The sponsor is the German Hodgkins study group and the University of Cologne. But we are funding this study, and it's a great prospective, large, open-label phase 3 study that it's investigating a new regimen called BRCAD, which incorporates Adcetris, which is an anti-CD30 targeted therapy in the frontline treatment of Hodgkins lymphoma. And this is the second trial where Adcetris is being tested in that specific disease setting.
And I think I was at the highlights of the day panel this morning, and they talked about it as potentially practice changing. Tell me about kind of what the implications are out of the study.
Absolutely. Well, the study read positively both its results, its endpoints, last year, but this year there was an amendment and on efficacy, and it showed that both safety and efficacy is better with the new regimen of BRCAD versus the standard of care escalated PICO. But to give you a little bit of background, Hodgkin's lymphoma is one of the most curable human malignancies, but it mainly affects young people, the median age between 30 and 32 years. So it's not only important to deliver a cure, it's also important to deliver it in a way that it's not associated with short or severe long-term toxicities. So one of the best regimens introduced in the frontline is a regimen devised by the German Hodgkins study group back in the late 80s. And this regimen was bringing the best disease control out of all the other regimens, but it was also associated with a high burden of toxicity, both short and long term, including the development of second heme malignancies like leukemias or a high rate of infertility. So for the past 20 years, the Germans were trying to reduce the toxicity while retaining the efficacy of their escalated PICO. So the latest idea to improve the benefit-risk ratio of this regimen was to include a targeted agent, and this was Adcetris. Now this regimen was compared head-to-head with their standard of care, which, by the way, was used in about 30% of all sites in Europe and in certain other countries and sites, and to find a way to reduce the toxicity. And that's what was the main objective of that study. So the study demonstrated that the safety is improved by almost 30%, but a sort of a byproduct was that later on in the 4-year analysis, which is presented in this ASCO meeting yesterday, they showed that through better safety, the efficacy was improved as well. So they found out an unprecedented high progression-free survival that beat all the previous German lymphoma study group results. So this is the important, and it's really, really impactful because it means many more patients might be cured from this lymphoma without having the high burden of intolerable diseases and other side effects.
So Adcetris is something that's already on the market in use in other use cases, other indications. What does this mean for Takeda in terms of how much more of a market there is if this becomes kind of the standard of care for Hodgkin's lymphoma?
Well, I would like to turn the question mainly for the patients. It's good for the patients, and actually Takeda is trying to introduce it with a proper label into the market. This is something that is under work at the moment. So what we're trying to do is to allow patients to be treated with one additional regimen, which appears to be one of the most effective regimens, and that means patients will have more options. 20 years ago, these patients had only two options. One was a very low intensity, well tolerated regimen called ABDD, and the other one was the German approach, the escalated BICO. So now we have additional approaches. But you are right, Adcetris is already approved in the frontline setting, in the same setting that HD21 is investigating now, with another regimen called A plus AVD, where we have shown that this regimen outperforms the classic ABDD. So this will be the second regimen in the same disease setting, and that means patients can choose now which approach they want to take, the more intensive or the slightly less intensive, but with equally good results.
So, taking kind of a step back, you mentioned that Hodgkin's lymphoma is one of the more curable cancers, but it seems like the general kind of the trend, the mission now in research is to make those cures safer, more tolerable, less toxic. So what is, I mean, your own work, other work at the show this year, and what are kind of the steps in that direction that are being taken, and where, I guess, what does the roadmap look like?
Yes, it's a very good question. Thank you for this. So there are different strategies and approaches to reduce this toxicity without, however, affecting the high efficacy of whatever we're doing. One of the approaches is, for example, to reduce the amount of chemotherapy. Another approach is to reduce the length of therapy. Another approach is to adapt the intensity or the length of therapy according to the pace of the response of the patients, which means those who respond faster will get less exposure to chemotherapy, whereas those who respond late and have a higher risk of progressing, they tend to get more treatment or more intensive treatment. These are the approaches. And the recent study from the Germans has shown that we can deliver a curative regimen within a very short time frame. And in fact, the new regimen of Brecad is being delivered over 12 weeks, which means we can cure Hodgkin's lymphoma, which is an advanced malignancy. There's no doubt about it. It kills people if it's undiagnosed. We can cure it with 3 months of treatment, which is
Wow.
which is impressive. I mean, apart from surgery or radiotherapy to very limited cancers, this is perhaps a unique situation where an advanced malignancy can be cured with just 3 months of therapy.
And for a childhood cancer, I mean, when you're a child with cancer, you don't get those months or years of your life back. So being
Absolutely.
able to get them in and out quickly and not having it kind of take over is really powerful.
Absolutely, you're right. So these people can return back to the normal life, to their families, to their work much faster. And in fact, specifically on Hodgkin's lymphoma, the quicker you finalize your treatment and you're off without any evidence of lymphoma, the side effects are getting progressively lower and lower, and their effects, if you like, are disappearing much faster. There's less fatigue, there's less impact overall in your life. So it's very important.
Talk to me a little bit about the mechanism side. You said this is a targeted approach, and the standard of care it was being compared to was not targeted, or
Yes.
so how like specifically, like, is it what? How does it work? What is it targeting? I mean, don't
Okay.
get too specific, but
Right. So Adcetris is an antibody drug conjugate. So it attaches together a chemotherapy drug with a monoclonal antibody. The monoclonal antibody brings the drug directly to the cells that are responsible for Hodgkin's lymphoma, and these are expressing CD30. So Adcetris is an anti-CD30 drug conjugate. Once the drug, the molecule, recognizes the CD30 on the Hodgkin's lymphoma cells, it brings into contact the drug, the chemotherapy drug,
Right.
with the abnormal cell. So there we have something like a targeted missile, where the chemotherapy drug is not being diffused to all cells. It doesn't go to normal tissues, or it goes to a much lesser extent, but instead it goes specifically to the abnormal cells.
and that's what's responsible for the reduced toxicity. 'Cause
Exactly.
you're not
Exactly.
doing collateral damage, as it were.
Exactly.
Um, A lot of talk about ADCs this year. I mean, last year too, but this year really seems like that field has kind of um, blossomed. I guess and there's so many different targets being explored. Where do you think we are kind of in the story of ADCs? Is this going to be the big year? Are there going to be even more ADC success stories next ASCO?
I think ADC has been demonstrated to be a very successful platform, exactly for the reasons we just discussed. They bring in contact the specific abnormal cells with the targeted drug, and so it gives us a lot of advantages over classic chemotherapy, which attacks everything in front of it, everything. So normal and non-normal cells. There are a lot of advances in all kinds of solid tumors and heme malignancies with ADCs. I think it's going to continue to be a very important platform for delivering good therapies for oncology patients, in addition to immunotherapies. They are part of immunotherapy field, if you like, but we have other more specific immunotherapy drugs. Right. So I think they will continue to be at the forefront of our treatment choices now.
More generally, what else are you thinking about day to day at Takeda in the lymphoma group at Takeda? What are you hearing and seeing at the conference? What's on your mind?
Well, in Takeda Oncology, we aspire to cure cancer with transformative medicines. So I think we are pretty excited to see that Adcetris was able to deliver this aspiration through the work of German Hodgkins study group. This group was founded back in 1972, so almost 50 years, and their main objective was to cure Hodgkin's lymphoma. So I think we are happy and we align with their objectives, with our aspirations, and we continue to look into research that will bring transformative medicines to cancer patients. And in doing that, we are working very closely with patients, with patient organizations, and of course, all major scientific groups. We continue to have a very strong heme oncology attitude, but we're looking also for solid cancers.
One more question for you. I've been asking this to everybody. It's kind of for like a quote roundup we're doing. What advice would you have for a young professional entering the field of oncology right now?
I think there couldn't be a better timing for someone to enter the oncology field. And this is because there's so much hope, so many different treatment solutions and options. People like myself, or even older than me, when we were getting into oncology, we had to face a lot of challenges, a lot of disappointments, and honestly, we had to experience dramatic stories with specific patients. This is not so much the case now. We are able to deliver much more curable, efficient, tolerable treatments, and we can see in front of us this hope blooming. So, for example, we can cure more than 90% of childhood leukemia now. It's a dramatic change. We have a large number of physicians who have been treated for acute leukemia or even Hodgkin's lymphoma in their teenage age or their childhood. So this hope is going to continue, and I think the new generation of oncologists will be in the best place to serve patients with cancer now.
Thank you so much, Thanos. Really appreciate you taking the time today, and congratulations on the study.
Thank you for the invitation.